Okay, let's unpack this. You know that feeling, right? Right before a doctor's appointment. Your head's swimming with questions, things you want to ask. But then you walk in, the clock's ticking.
And poof, it all just vanishes.
Exactly. Your mind goes blank. It happens to so many people. And, studies I've seen suggest the average visit is only about, 15 to 20 minutes.
That's right, which really isn't a lot of time when you think about it. It really highlights why being prepared, being strategic is just so important.
Yeah, making every second count.
Precisely. And there's research showing that patients who actually do prepare, they feel more confident, they remember more information, and, well, they make better decisions about their care.
That makes total sense. And that's exactly what we're diving into today. We're not talking about cramming for a test here.
No.
This is about getting you the tools, the strategies to handle those moments better. We've pulled together advice from, all over pacing communication guides, checklists, even looked at how places like Joint Commission International and NABH operate.
Right. Those are the big accreditation bodies for hospitals.
Yeah, and while they focus on overall quality and safety standards in hospitals, guess what keeps popping up as crucial?
Effective communication between the patient and the medical team.
You got it. It's not just a nice to have for them.
No, it's fundamental. It directly impacts patient safety, the quality of care. It's woven into those standards.
So our mission today is pretty straightforward.
Yeah.
Give you practical ways to walk into that next appointment feeling, more confident, more informed, maybe more controlled.
Being an active participant, essentially.
Yeah, exactly. Like the folks at Johns Hopkins Medicine say, good prep and clear communication. That's the key to bridging the gap in today's, let's face it, pretty fast-paced healthcare world. And it leads to better outcomes for you.
It really does set the stage for a much more productive conversation. You shift from just sort of passively receiving information to actively managing your health.
Couldn't agree more. So let's start with what you can do before you even walk out the door. And honestly, it kind of boils down to making lists. Simple, but powerful. First up, questions and concerns. Experts recommend just jotting them down whenever they pop into your head. Could be weeks before, could be on the bus ride over.
Yeah. Don't underestimate how much anxiety can mess with your memory in that room. Writing it down. That ensures the important stuff doesn't just disappear.
Totally. And if you need some inspiration for what to ask, check out resources like the Longevity Foundation. They have these amazingly detailed lists for all sorts of situations. New diagnosis, tests, different treatments, surgery, radiation, chemo, even the newer stuff like targeted therapy or immunotherapy.
Wow. So really specific then.
Yeah, angiogenesis inhibitors, clinical trials, palliative care. The lists are huge. They really help you think through what you need to know.
And that specificity is interesting, isn't it? Because a generic list might miss the mark. Targeted therapies, immunotherapy, they work very differently from traditional chemo.
Right. They might target specific cells or boost your own immune system.
So having questions tailored to those mechanisms is incredibly helpful for understanding what's going on.
Absolutely. It's not just what are my options. It's digging into the details of each path. Okay. Next on the pre-visit list, tracking your symptoms.
Ah, yes. Very important.
The advice is to note down the time, the date, how long it lasted, what it felt like, maybe what you were doing when it happened.
That kind of detail is gold, especially if you're dealing with something chronic. It helps you and your doctor spot patterns, maybe identify triggers you wouldn't normally notice. It's like providing actual data.
You become your own health detective.
Yeah.
Then your medication list. This is non-negotiable, really.
Yes. Yeah.
An up-to-date list of absolutely everything. Prescriptions, over-the-counter stuff, vitamins, supplements. You need the dosage, how often you take it, and if you're unsure, bring the bottles.
Good tip. And just as important, mention medications you stopped taking and why. That history matters. Maybe you had a reaction, maybe it didn't work. That informs future decisions.
That's a really good point. Also, don't forget to note any big changes since your last visit. Were you hospitalized? Did you see other doctors? Or even life stuff, changes in finances, family, living situation. Any struggles you've had managing your health.
Because all of that provides context. These life changes can definitely affect your health and how you manage it. The doctor needs the whole picture for truly personalized care.
Makes sense. And finally, before you go, take a beat. Think. What do I actually want to get out of this visit?
Define your goals.
Yeah. Is it tackling a new symptom? Changing a medication? Just understanding how this condition affects daily life. Having that goal keeps you focused when time is tight.
It's like having a roadmap for the appointment. It keeps the conversation on track towards what matters most to you.
Okay, switching gears slightly, the practical stuff, logistics. Longevity reminders, call and confirm the appointment.
Huh. Seems basic, but oh so necessary. Mix-ups happen.
They really do. A quick call saves potential headaches. Another key thing, gather relevant past medical records.
Yes, especially for a new doctor or a recurring problem.
Both Longevity and the Supreme Medic podcast stress this.
It avoids repeating tests unnecessarily and gives the provider your history right away. Much more efficient.
And here's one that sounds simple, but helps a lot. Arrive a bit early, maybe 15, 20 minutes beforehand. Gives you time for paperwork, finding the place, just settling in without rushing. Reduces stress.
Totally. Rushing in just makes you feel flustered, and that doesn't help clear communication.
Definitely not. Now, what about bringing back up a support person?
Oh, highly recommended.
Yeah.
Especially if you expect difficult news or complex discussions.
Yeah, experts really emphasize this. They can take notes. They can jump in with questions you forget.
Provide emotional support. Offer a different perspective later when you're processing it all. It's like having a second pair of ears.
A second pair of ears. I like that. Okay, so you've done all the prep. You're in the room. How do you make that time count?
Well, first and foremost, open, honest communication. Can't stress that enough.
Right. Experts everywhere, Johns Hopkins, NIA, they all say be upfront. Lifestyle, social factors.
Yeah.
Even stuff that feels, embarrassing.
And it's understandable to feel awkward sometimes, but doctors aren't there to judge. They've likely heard it all before.
True.
And that information, even the awkward stuff, is often vital for getting the diagnosis right and finding the best treatment plan. They need the real story.
Exactly. And here's a proactive tip from Johns Hopkins. Try setting the agenda right at the start.
How do you mean?
Just briefly mention the main things you want to cover. Doctor, I'd really like to talk about X, Y, and maybe Z today. Helps prioritize, given the time limit.
That's a smart approach, though it's good to remember the doctor might have their own priorities too, based on their assessment. It's about finding that balance together.
Good point. Then active questioning. Don't be shy. Ask questions in plain language.
Absolutely.
And repeat back what the doctor says in your own words. Okay,
Yeah.
so just to make sure I understand, it really helps confirm you're on the same page.
And it's perfectly okay to say, hang on, I'm not following you, or could you explain that differently? Medical jargon can be confusing. You have the right to understand.
Definitely. And keep taking notes. Just like you did before, jot things down during the talk.
Yes, those notes are your reference later.
You can also ask for printed info or where to find reliable stuff online.
Good idea. Anything to reinforce the information.
And here's a simple but effective one from Longevity. State your main problem first.
Get right to it.
Yeah. I'm here today mainly because of this persistent cough. It focuses the conversation immediately.
Makes sense. Gets the primary concern on the table right away.
And finally, remember, this is teamwork. Work with your doctor. Share your concerns about treatments. Ask them to compare the risks and benefits.
You're a partner in your own healthcare. Your preferences matter. Ask why they're recommending something. Understanding the rationale empowers you to make choices that feel right for you.
Okay, so the appointment itself is done, but you're not finished quite yet, right? There's the follow-through.
Exactly. What happens after is just as important.
First step, review those notes pretty soon after the visit while it's fresh. If you brought someone, talk it over with them.
Discuss it.
Then, make a clear plan for any changes or actions you agreed on.
Right. It helps solidify what was discussed and turns the conversation into actual steps you can take.
And it's really helpful, experts say, to summarize the next steps at the end of the appointment before you leave.
Oh, definitely. Just a quick recap.
Yeah, okay, so the plan is, I'll start the new medication tomorrow, schedule a follow-up for next month, and try those dietary changes. Ensures everyone's clear.
Prevents misunderstandings. Gets everyone on the same page about what happens next.
And Longevity has another great checklist for this part. Key questions to ask before walking out.
Like what?
Like, do I need a follow-up? How do I get my test results? Are there any danger signs I should watch for? When should I report back? And that catch-all, is there anything else I need to know?
Those are essential. Covers the logistics, the warning signs, the communication plan. Leaves you feeling equipped.
Exactly. Now, we mentioned those detailed longevity question lists earlier. Just wanted to quickly touch on them again. They're not just for general checkups.
Right. You said they were tailored.
Yeah, really well tailored for things like a new diagnosis, specific tests, different treatments, surgery, radiation, chemo, targeted therapy, immunotherapy, even for palliative care or hospice discussions.
Which just reinforces that point about preparation being specific to your situation.
Yeah.
Having the right questions ready for those complex scenarios makes a huge difference in understanding and decision making.
Totally. Okay, so let's wrap this up with the key takeaways. Before the visit, lists, lists, lists. Questions, symptoms, meds, changes, goals. Handle the logistics, confirm, gather records, arrive early. Maybe bring a buddy.
Preparation is key.
During the visit, be open, be honest. Set an agenda if you can. Ask questions, repeat things back, take notes. State your main issue up front. And remember, it's a partnership.
Engage actively.
And after the visit, review your notes, make a plan, summarize next steps before you leave. Ask those final clarifying questions.
Follow through and ensure clarity.
Ultimately, it all comes down to your active participation, doesn't it? Being prepared, knowing what to ask, that's what makes you an empowered partner in your own health.
Couldn't have said it better myself. That active role is crucial for getting the best possible care.
So here's something to chew on. Think about your next doctor's visit. What's just one small thing, one manageable change you can try beforehand?
Interesting prompt.
Maybe it's just writing down 3 questions or making sure you have that med list updated. How do you think even that small step might change the dynamic of the consultation? Something to consider.
And even those small steps can build momentum, leading to better interactions and ultimately better health outcomes over time.
Absolutely. So our final thought is really one of encouragement. Be prepared, feel confident, and take that active role. Communicate clearly you've got this.